UP CrossFit community, this is part one of a two-part series talking about the anterior thigh muscle group. And this muscle group tends to get really overworked if we're doing a lot of squats, a lot of lunges, a lot of lower body type of exercises, which we've been doing. And so I wanted to just talk about some ways that we can work to decrease the tightness in this tissue and to make sure that it's functioning properly, because it can really have an effect on the rest of the body. So this video, we're going to talk a bit more specifically about some anatomy, physiology, and how this is kind of affecting everything else. And then part two, we'll look more at the methods that we can utilize to help decrease the tightness and get better function out of this tissue. And so the area that I'm going to be talking about, the anterior thigh group, is right here. And this group attaches in to the pelvis and into the knee, okay? And it, as a kind of a point of reference, if this muscle man had a belt on, his belt would be right there, and it's kind of held up by this anterior pelvis. And if he had pants on, his front pocket would be about right here. So you kind of get an idea of where this stuff is at. And the reason that's important is because when people go to roll out their quads with like a foam roller, oftentimes they focus a lot of their tension in through the middle of the muscle, which that area needs to be addressed, but you'll actually get a lot more benefit if you go towards the ends of the muscle. So making sure that you are working through this area that's attaching up through the pelvis, and also this area that's attaching down by the knee. And then another area that oftentimes gets neglected is the inside of the leg. So these are all areas you definitely want to make sure that you're getting to get a full benefit out of doing your myofascial release, which I'll demonstrate in part two. Okay, now for some more kind of physiology as far as how tight quads are affecting the rest of your body. Obviously, it doesn't feel good, it painful and all of that, but there's a lot more to it than that. And so for that, we're going to go over to this diagram here, and we're going to look at the skeleton from the side. So from the side, these muscle group I'm talking about attaches from the pelvis, comes here and attaches down through the knee, okay? And why that's important is because if these areas get overly tight and contracted, it ends up shortening, and that shortening effect actually causes the pelvis to rotate forward. And that's important because it will actually tighten up the low back, and it'll also cause the abdominal muscles and the glute and hamstrings to not be able to work as well. And so if you have low back pain, if you have difficulty activating your abdominals or glute muscles, and you also have or don't, but if you also notice a quad tightness, all of these things can be related to that. Okay, so let's talk about what some things that we can do to try to reduce the quad tightness. So the number one thing I would say is making sure that we work on the tissue either with self-myofascial release or stretching or both to reduce the tightness in that muscle. The second thing I would say would be to make sure that we get good activation in through the glutes and hamstrings. So during your warm-up, you want to make sure you're doing the warm-up, getting good activation in through those muscles. Also, just kind of being aware when you're doing exercises, like when you're squatting, lunging, trying to see if you can modify slightly so that you're getting more activation in this muscle group compared to this muscle group. A couple ways to get more activation in through the posterior muscle group is one, paying attention to your body position. So, center of mass should be in the center of our body through all movements, ideally. And so when you're squatting, when you're doing lunges, sometimes people will have a tendency to do the movement in a way that the center of mass will move forward slightly. And so that might look like the upper body coming way forward like this. It might look like, it can look like a variety of ways, and that's not so important. But the fact is trying to get your center of mass centered or back slightly will actually put more of the load in through the hamstrings and glute muscles. And so when you're squatting or lunging, trying to hinge back a little bit more, that can be a slight modification you can do to try to get more activation back here. Another thing is also where you're kind of driving your pressure through your feet. Now, in each movement that we do with our feet, the load through our feet can be in various places. And it's important that, through all of the movements that we have our foot flat on the ground. But oftentimes people that kind of become quad dominant or use a lot of the anterior thigh muscles, they'll put a lot of load in through the big toe and inside of the foot. And so if you try doing a squat or a lunge with your weight mostly through your big toe or inside of your foot, you'll feel a lot of activation from your quadriceps and anterior thigh muscles. If instead you move most of your weight and load that you're driving through with your foot to the outside and back part of your foot, while still keeping your foot flat on the ground, you're just pushing through the outside and the back of your foot, you'll actually feel a lot more load going through the hamstrings and glute muscles, which can be a slight modification that you can try making while you're squatting, lunging, other lower body type movements. Okay, so that's it for this video. Part 2, we'll be showing some more specific methods on how to work out this tissue and specific advice for stretches, exercises, myofascial release techniques. And so stay tuned for that.